Alright guys, Dr. Drew here with Inspire Cosmetic Surgery. We just finished a double incision surgery. We're around day 5 of follow-up when I like to take the nipple areolar graft bolsters off. Those bolsters are little yellow dressings. We're going to remove that. So I've taken the compression shirt off and I am going to uncover both sides. This is right from the time of surgery. I'm just putting a little antibiotic ointment over the wounds. The wounds look great. We're now ready to take the bolsters off. Hey, Dr. Drew here. We're getting ready to take the nipple areolar complex free nipple graft bolsters off. So they are sewn in place to hold the graft down so they don't float off of the wound while they're trying to take. So I'm going to remove those bolsters right now. That's easily done by just snipping the sutures that hold the bolsters to the skin. So we're just going to unfasten those sutures, and that should release the bolster completely. So they're tied in several areas, and then we'll just peel the bolster back and check the viability of the nipple areolar graft. We usually put the graft on in an oval shape because they tend to stretch out into a circle. So we're doing that now, taking out the stitches that hold the bolsters. Loose and slippery, and you can see the graft here, and the graft looks like 100% tape, so it looks excellent. Okay. We have taken off our nipple areolar graft bolsters that held the nipples in place while they were taking or healing in place. Now, the only wound care we're going to do for 1 week is to apply triple antibiotic ointment to the wounds. This is enough for both breasts. So we're just going to put the ointment in a thin, shiny coat around both sides and right over the graft itself. It should not be thick. You should not be able to wipe it off. Just see it shiny. We're going to put that over the incisions as well, and that will help the incisions to heal quicker. It will keep the wounds moist and give us a better overall result. So I'm going to do the same thing on the opposite side. Just a little bit of ointment around the periphery of the nipple areolar complex, right over the graft itself, and then along the entire incision line. And that's all that's required for wound care. You can see the drains in place, and we remove those drains when there's enough decreased drain output that we won't have fluid collection inside behind the grafts.